Welcome to California Edition. My name is Brad Pomerance. I'm glad you're with us. Over this half hour, we'll be speaking with two members of the California legislature. We'll start with Senator Ed Hernandez, and then we'll be speaking with Assemblyman Steve Bradford. But we start with Senator Hernandez. He is the chair of the Senate Health Committee. And as you know, sir, recently the United States Supreme Court, in a 5-4 decision, all but upheld the Affordable Health Care Act. I want to speak about its provisions, starting with the individual mandate, which was upheld under congressional taxing authority. What do you make of that provision?
Well, obviously it's an important provision, and when we first heard it, we thought it was going to be stricken down by the Commerce Clause, right. So I was kind of worried, but it was still upheld because it's a tax. Doesn't matter how you dice it or slice
right.
it, most important, that provision is in to allow more individuals in the exchange.
Why? And that's the key. I really want to understand why the mandate needed to survive if the Affordable Care Act was to be successful.
Well, let me first say that it's not necessarily the mandate that needs to survive. What is absolutely most critical is we need to get as many healthy lives into the pool. Because what happens is if you don't, you can't spread risk
right.
and costs don't go down. So it doesn't matter how we get there, whether it's natural market forces, but we need to get as many individuals into the exchange and healthy individuals.
Now what's interesting, and it's in large part because of the senator before me, we have a health benefit exchange that's going to launch pretty darn quickly. Yes. And I understand that we actually are accessing, is it almost $200 million from the feds to create the computer system?
Right. Right.
Explain.
Well, I mean, California has always taken a leadership role in healthcare, going back to 2007 when we tried to do AB 8. Right. Now, what California has done, we are the first state to have an exchange in the country, and even now, being the first state with the upholding of the ACA, we're still barely going to make it. We are going to continue to take a leadership role, trying to draw down as many federal dollars as we can to make it as successful as we can, get the infrastructure in, we've got the board in place, we're getting contracts to make sure we can get the outreach to the consumers.
So explain how the health benefit exchange works for Californians.
Well, first of all, we have to do what's called the essential health benefit, and that's a bill that I'm running right now, which determines what the absolute minimum is, no, the floor. Then you have what are called the 5 precious metals that individuals can buy from your basic all the way up. So it's sort of like a tiered structure of benefits. Now, whether in the exchange or outside the exchange, all those products have to be sold the same, but within the exchange, the advantage that a consumer has is if you fall below a certain percentage of poverty level, you get subsidized help from the federal government to help pay for those various levels.
And is the purpose of the exchange to allow, for example, those that don't get health care from their employer to have bargaining power because you are with a group and the group can negotiate better rates on behalf of those individuals?
Exactly. I'll give you an example. Somebody who is a small business owner who just buys an individual coverage doesn't have that buying power prior to the exchange. Why is it that CalPERS can continue to keep their costs down? Because they have a large pool of individuals, they spread the risk, and they have a much more ability to bargain with the insurance companies. The exchange is going to act like this huge monster with all these patients where they can negotiate the absolute best price on behalf of them.
At the same time, also upheld as a result of the Supreme Court ruling is the requirement that by 2014, firms with 50 employees or more must offer health insurance or pay a penalty. Right. Are you concerned that firms will just pay the penalty?
They can, or what could happen is they'll say, you know what, we'll give you money to go into the exchange, but I think the system will work itself out, and as we get more individuals in and businesses find out that it's less expensive, they're going to purchase it. The other thing too is what is it that businesses need to do, and whether it's in California or this country, they need to compete. And the way they're going to compete is by offering benefits.
Do you believe that that level of competition will build? Because there's no doubt the largest corporations, they'll maintain their health care coverage. But when you start getting to medium and small businesses, is that competitive advantage important as it relates to health benefits?
I think it is. And as I said, you know, with the competition we have in business, businesses are going to want to attract the absolute best employee, and they're going to want to offer these products as opposed to not offering it at all. So I think it will work.
We know that one of the largest employers in the state of California is the state of California. Mm-hmm. And I am wondering if the Affordable Health Care Act helps California get its health care costs in line.
Well, I mean, California does their buying in large numbers, so they are doing really well already. I think what this is going to do is help those small businesses, help the individual market. It's going to help the smaller people who don't have those.
California, as an employer, doesn't gain necessarily or lose necessarily.
I don't think so. I think they'll gain as overall, because overall healthcare costs should hopefully continue to drop as we spread the risk, because everything is cost shifted. Because what's going to happen is the uninsured or the underinsured right now are going to utilize it most inefficiently going to the emergency room, and there's still going to be cost shift with the larger groups like California.
I also want to talk about the second part of the Supreme Court's ruling, and that dealt with the expansion of Medicaid.
Right.
And what the Supreme Court held is that the federal government cannot withhold all Medicaid funds if a state refuses to participate in the expansion. Right. They have to keep that base level. Well, we know that, let's call them the blue states, right, like California, even a Republican governor, Schwarzenegger, signed up for the expansion of Medicaid. Those states will sign up. The red states, Florida, Wisconsin, Nevada, not necessarily all red,
right,
their governors have said, we're not going to play. So what does that say to you? I know you're a state senator from California, but are we going to have haves and have-nots?
Well, maybe. And you're right, California will definitely take advantage of it because we need to subsidize that segment of the population which is the most neediest. Here's what I would anticipate would happen with the so-called red states. There's going to get a lot of political pressure there from the hospitals, the provider networks, and the provider community, because they're going to say, hey, we want this reimbursement rate, because at 2014 you're going to be able to get 100% of Medicare, and they're going to be asking their legislature to bring that money in. That's a significant amount of money that the states are going to turn around. So they're going to be in a really tough political position. So I would anticipate that they're going to take the money.
Recently we saw a state budget pass, and there were some serious cuts to healthcare, shifting children into a Medicaid program, cutting home health care. Does this ruling upholding the Obama Health Care Act impact those cuts? Can we start pulling back those cuts and refunding these programs?
It'll help. Let's first talk about the healthy families moving from there to Medi-Cal. I know there was a lot of concern, but I think what we have to do in the state, most importantly, is rebrand the whole thing. Medi-Cal, healthy families, rebrand it as a health product, not Medicaid or welfare. Because now they're going to be drawing down federal dollars, and keep in mind, there's going to be about $15 billion coming to this state now that we're going to be able to get money from the feds to make it work.
When does that start?
2014. We're going to be bringing a lot more money in.
It's interesting, when you look at the public view of the Affordable Care Act, individual provisions had been very successful and supported. The overall act was not very popular. But since the Supreme Court ruling, we have seen the support rise for the Affordable Care Act. We have also seen, with majorities, not even pluralities, would prefer that the Republicans, the opponents of the Health Care Act, move on. Right. What do you make of that? Is this a bump? Or do you think that the voters, the Americans, really want the Republicans, the opponents of the Health Care Act, to move on?
I think they want us to move on once they learn the issue. Here's what makes healthcare so difficult in the discussion is because those who have it are afraid of change, but those who don't have it want healthcare reform. And if you look at the argument with the Republicans, it's the same argument that they've had in Massachusetts. They have an exchange, they had healthcare, they had the mandate. Now you're seeing the public realize what was put forward to them. Guaranteed issuance, insuring your kids up to age 26. There are things that they really like. Now, if you're going to take that away, that's going to be a real problem. Once the public sees the benefits that this is going to bring to them, you're going to see a movement to want to continue with it.
California also has unique challenges because of its demography. And we have a large segment, not a large, but a segment of our population which is undocumented. And if we look at the potential participants in the new programs, the undocumented are excluded from many programs. And the concern becomes, if you're a supporter of this plan, that the way we're going to save money is we won't have people going to the emergency room as their primary care physicians. But if you have 1 million, let's say, undocumented individuals not being able to access health care, where's the economies of scale?
Well, that's true. They may not be able to access health care. That doesn't mean they can't still buy it. They can still purchase it themselves outside of the exchange because the products are still available.
Can they purchase inside an exchange if you're
That
undocumented?
I'm not sure.
Nor
That
am
I don't think so. But here's the other thing too. The federal government, with this additional money, there is a significant amount of money that's going to go to what are called federally qualified health centers. Those health centers will have sliding fee scales for individuals who don't have health insurance. Therefore, we're going to be able to get care for that segment of the population and shifting the cost away from the emergency room.
But how do you get that message out? Whether it's undocumented or those that would qualify. I mean, think, for example, about the earned income tax credit. For those, it's really for, I guess we'll call it the working poor, but you don't even have to be that poor to qualify for this tax credit, and so many don't access it. You know, how do we get the message out that a family who's making a decent living, especially in Los Angeles, you could make $50,000 and that's considered working poor in some areas, to be able to access it? I mean, for families making up to $92,000 can access federal subsidies. Yeah. That's a nice chunk of change.
And here's where the exchange is going to come in. They're drawing down money right now to be able to do those marketing. 2014 hits or before that, they're going to start signing up individuals. You're going to see, one shop calling, a phone number, access through the internet. It will become more efficient, and we also have to rebrand our Medicaid or our Medi-Cal as well and say this is a health plan for these individuals as opposed to welfare.
You are a doctor of optometry, so I want to get a sense from you, not just as a state senator, not just as the chair of the health committee, but as a doctor of optometry, what you make of this plan. There's a lot of confusion. Some say it's a government takeover. Others say we should have done single payer. You get diametrically opposed views. What's your sense of it, Dr. Hernandez?
This is my sense, and this is the reason why I ran, to make sure that everyone has access to health care. I believe that the Affordable Care Act is the most important piece of healthcare legislation that this country has seen since the mid-60s and under the Medicare Act. It is. United States of America is the only industrialized country in the world that doesn't offer some form of healthcare to its citizens. We need to move forward. Had it been struck down, we would have gone backwards. The discussion now means it's done, it's over, let's move on. Let's provide this care, this much needed care, to our consumers and our residents.
In your mind, will the opponents move on? We hear the Republican presidential nominee saying, repeal and replace. I'm not sure what his plan is to replace. I don't think he's given that plan. But what about even in California? I mean, can steps be taken by those opposed to the plan to prevent implementation?
Well, I will do everything I can as chair of the Senate Health Committee that anything's changed, that we'll continue as a state to move forward. I believe the country needs to continue to move forward. And it's kind of interesting to see the Republican nominee for president say he's going to oppose this and try to strike it down when what he put forth as governor is the exact same thing of what's occurring right now in this country. Literally the same thing. And you know what the saying is? You know the difference between Obama's health care and Romney's health care?
No.
There's no difference.
Really?
It's the same thing. So
it's a state implementation.
Yes, and a mandate. Exactly what the Republicans had pushed for.
His name is Ed Hernandez. He is a member of the California State Senate, also chair of the Senate Health Committee, and a doctor of optometry. When we come back, we'll be speaking with Assemblyman Steve Bradford. I'm Brad Pomerance. We'll be right back on California Edition. Welcome back to California Edition. I'm Brad Pomerance. Our guest, Steve Bradford, he's a member of the California State Assembly, also the chair of the Utilities and Commerce Committee. And as a result, I want to speak with you about the next great thing, which is solar power. I think there's a lot of excitement surrounding it, and we know a lot of jobs are being created as a result of it. But you have some concerns about how we are incentivizing solar. Talk to us about that, sir.
Yeah, I have a bill, AB 2514, in which this bill simply does a such study to see what the cost and benefits are to ratepayers. Currently, if a commercial or residential customer puts solar on their roof, there's something called net energy metering, which allows them to sell back what is considered excess power back to the grid, and the utility has to pay for that.
And that's supposedly one of the great benefits of
Yes.
it. But you're concerned, though, about the formula
Yes.
in which that energy is being sold back to the grid.
Most definitely, because as we know, there's no free lunch, and ratepayers, those non-solar customers, pay that subsidy to those solar customers. Please understand that despite the fact that when you have solar on your roof, you still have transmission and distribution that the utilities are responsible for. They still have a monthly billing that they're responsible for. They still have all those other public goods programs that they don't go away. But by having solar on your roof and getting a NIM, you no longer pay that cost, and those costs are absorbed by those other ratepayers.
But are you concerned that if we somehow change the formula so solar customers aren't getting that incentive, that we will disincentivize solar? I mean, it's a burgeoning industry. It needs, one could argue, all the help it can get.
It's not about taking that away, just making sure it's fair and equitable. Again, the biggest thing you hear in California is our high electric and utility costs in California. Well, when you start paring back on that bill, only about 20% of that is generation cost. All of the rest of it's all those things, administrative costs, transmission.
How did this come to your attention?
Well, just being in the industry and working around it, and again, understanding there was a study done a number of years ago by the PUC, and it showed that there was clearly a cost shift of as much as $1.5 billion that other, again, non-solar customers have to absorb. Again, those transmission and distribution costs do not go away. It's just absorbed by fewer and fewer customers who, you know, once you get more solar customers, it's fewer customers who carry on that entire
But
burden.
is it cheaper for the non-solar customers to buy the energy from their solar neighbors, or is it more expensive?
More expensive because
Really?
you pay a higher rate for that renewable commodity. And that's the real issue here, because I can produce gas-powered, generated electricity or hydro at 7 cents a kilowatt. Let's use that number. Solar ranges somewhere between 17 to 27 cents
What
a
about
kilowatt.
the offsetting benefits of the environment?
Well, there is a challenge there too, because understanding that the sun doesn't shine 24 hours a day, the wind doesn't blow 24 hours a day, you're still backing it up with that same quote-unquote dirty power. So
At night.
At night, and even in the daytime, because again, if the sun doesn't shine during the daytime, you still relying on your utility company.
Right.
And at the same time, those plants have to run, but they're, instead of running at peak capacity, they're running at a at an idle kind of level. So they're emitting far more greenhouse gas emissions. They're running at a far
Because
less
at idle level,
Yes, instead of
there's worse.
Yes, without a doubt. It's almost like your car sitting idled in your driveway. It emits far more pollution than if it's, doing 55 miles an hour on the highway.
So what's the response been? I mean, this is an interesting one, I must say.
It is, and that's the fine line we're trying to get to, because we're all promoting all these renewables, but we have to understand there has to be a fine balance on how do we get there. And it's not like some are saying, oh, you're trying to slow it down. No, we're not. But at some point, when will it stand all of these technologies on their own and without all the addition? There's federal, there's state, and there's ratepayer subsidies. At some point, we have to say,
But does this bill impact, for example, the solar farms that are being set up in San Luis Obispo County or Riverside County, San Bernardino County, or is that a completely separate issue?
No, it doesn't affect anybody right now. All it is a study. And
Right,
it says,
but would this study look at those?
it would just look at the data and say, is there a cost shift? And if so, how do we minimize that cost shift to those non-solar customers? That's all we're trying to get to.
So where are we with this bill?
Well, it just got out to Senate.
So it got out of your committee?
Out of the Senate Utilities and Commerce Committee. It got out of my committee a few months ago, and now it's on the Senate side. And again, we just want to compile the data. One of the things we're constantly criticized as legislators is we're always introducing new bills and legislation without the backup information or the data. This is data that's going to clearly say either keep the subsidy at where it's level.
What it's going to say.
No, we don't.
You don't? You don't have a sense?
I mean, I think it's going to say that ratepayers are subsidizing. It's no two ways about it.
At what level, though, and I'm being completely candid, at what level is the subsidy digestible, you know, in furtherance of the goal of green energy?
Probably providing the individual with solar the renewable attribute credit and not the retail credit. We're currently paying a retail rate for a wholesale product.
Right,
so
you had mentioned that.
Let's pay the wholesale rate, and we're fine with that. That's fair. But I'm asking now the utility to pay a higher rate than what it costs them to generate the power themselves.
Are you getting a lot of flack for this from the environmental movement?
Not well from solar companies, and again, we're not
so
trying.
The solar companies, not the environmental movement.
I mean, well, they're also, chiming in, but at the end of the day, it's all about ratepayer fairness.
Honestly,
and
I think about this. I don't know where the parties come down.
Exactly.
I mean, it's a very complicated. So, Senate side, then to the Assembly. If it gets,
it's already been to the Assembly, and now it's on the Senate side.
Oh, it's passed out of the Assembly.
Yeah, and if it gets out of the Senate, it goes to the governor's desk.
What do you think?
I hope it's sensible. I mean, the PUC is currently having a study, so we're mirroring ours that expand upon what the PUC is doing.
What are your friends on the Republican side saying, or the Democratic side for that matter?
They appreciate it because, again, they want to know what that cost is, that burden that's being placed on that non-solar customer.
So is your challenge your Democratic colleagues or your Republican colleagues?
I think the challenge is by those folks who are wedded to a particular technology and wanted to survive at any cost. And
it's fascinating.
That's probably the best way to describe it.
I'm glad you brought it up. It's a very interesting issue. I wanted to speak with you as well, Assemblyman, about the budget, about the upcoming tax initiatives. As you know, the budget that was recently passed really looks towards November to balance its current fiscal year. I look at the recent failure of the cigarette tax. Who would have thunk in California we'd vote down a cigarette tax, but we did.
Yes.
That doesn't bode well for the tax initiative that would tax everyone.
Yes.
Sales tax, higher income wage earners. Talk to me.
Well, it's going to take some work, and it's going to require all of us to educate the voters as to the benefits, because there are a lot of trigger cuts in that budget that are depending on they will go into action, and those triggers will be executed if, in fact, the November ballot initiative doesn't pass. So it's key that we do all that we can to shore up, the initiative so it maintains the budget.
What's interesting about the trigger cuts is they're focused almost exclusively on education. Now, look, I happen to be a parent of school-age children, and so presumably my family would be favorably inclined to the initiative, because if the trigger cut occurs, the school year will be cut by 3 weeks. CSU has already said that they're waitlisting everyone. But parents are but a small part of this population. There are plenty of retirees. They vote more.
Exactly.
Do they really care if the school year's cut by 3 weeks?
And it's a shame maybe they don't. I mean, and that's what we're finding out. It's kind of like, oh, that's their problem. I've raised my kids. I've gone through that. But I think at the end of the day, everybody cares about how California is perceived. We were once #1 in education. Now we're about 49th in the nation. And I think regardless of whether you have a school-age kid or a college-age kid, you want California to be that beacon of higher education and great opportunities, which we've all come here for.
Now, what's interesting about the initiative in November is it's not alone. There is a competing initiative. You could argue that Mr. Brown's initiative is to the left of center. Ms. Molly Munger's initiative is even farther to the left. So it's the left wing of California fighting with each other. So how concerned are you about the progressive wing of California fighting over two initiatives unlikely to both pass?
Well, at first it was 3. So we were able to, remove one and combine that with the governor's initiative. And yes, it's going to be a fight, and it's going to be about messaging and who's far more effective in getting their message out.
But what's interesting as well is there had been some suggestion that the Munger initiative and the Brown initiative would battle with each other, but they wouldn't go after each other that severely. They would do their own thing. But Molly Munger's team recently filed action in court about a law that recently passed. It would have put the governor's initiative first because it would have been a constitutional amendment. I mean, that group's fighting. They're
They are.
fighting hard. The suggestion that they're going to roll over, I don't see it. I'm just a neutral observer, but I don't see it happening.
No, it's no lay down there. And we know we're in for a fight. And again, the initiative that prevails is the one that receives the highest amount of votes. So again, it's
right. That is under right. If both, it's like Prop 8 and Prop 13. The one with the higher vote count will go forward, presuming they both pass. But again, I go back to the state has not passed an initiative on itself that would increase taxes since 2004.
Yes.
If there was ever an initiative that you would think would pass, would be a cigarette tax. We are one of the states with the lowest smoking rate in the nation. These are very difficult times. Are Californians going to say to themselves, I'm going to increase my sales tax by 1/4 cent for 4 years and on the wealthiest for 7 years?
We're hoping that they see the benefit of what it means to California as a whole in closing the deficit and allowing us to get California back on the right track. Again, as we've stated, California doesn't have a spending problem, we have a revenue problem. And
is that true?
Yes, it is. And in my time in the legislature, I've come to realize all the waste, fraud, and abuse that you hear about really doesn't exist. I mean, can we have some efficiencies of scale and do things a lot better? Yes, we can in all levels of government.
I was recently speaking with Treasurer Lockyer, and he said the same thing that you did. You compare spending today versus the Reagan era, Governor Reagan era. We're spending much less. We are spending less now than we did 5 years ago before the recession. But your friends on the Republican side, I mean, they will point to different statistics and say, we do have a spending problem. They look at the May revise, which said we spent $2 billion more than we had slated to spend. I mean, this is really a contentious issue on whether we have a spending problem.
Yeah. I really think it's overrated. Again, if you start peeling back all the layers, we're spending less again on education, on those healthcare and those human services programs that we were spending 5 years ago, 10 years ago. So it's not that we're continuing to spend like drunken sailors. That's not the case. As it's clearly been demonstrated, California has a revenue problem. We have a tax structure that's out of skew that doesn't allow us to pay for all those things that we have been accustomed to providing here in California.
So arguably, why aren't we looking at the bigger tax reform issue? You know, we rely too much on income tax. Our property tax formula has not been reformed since 1978. I don't know if Proposition 13 could ever be reformed. I mean, this is a structural problem. It's not right now we're in the middle of a recession. I mean, yes, although arguably it's getting better, but these are big issues.
Yeah. And I think not to pass the buck, but I think with this new incoming class that's going to have 12 years to wrap their arms around these big issues, you're going to see bigger bites of this stuff. Again, right now with term limits, no one's around long enough to do the heavy lifts on the major policy reforms that we need to address here in California. We
recently together saw a movie that was about Willie Brown, and he said very clearly, term limits be damned. Do you feel as strongly about the failure of term limits as former Speaker Brown?
Without a doubt. Without a doubt. We have a different institution that exists today that didn't exist when Willie Brown was...
But one could argue without term limits, Steve Bradford wouldn't be in the Assembly.
Probably true. I probably would not be here. But I guarantee you we probably would not have hit some of the fiscal challenges that we've had, the legislative challenges of getting things done, as Willie Brown has stated, as Pete Wilson has stated. It's been about relationships, and those relationships are fragile at best when you have a 6-year legislature.
In our final moments, were you surprised that the voters so strongly passed the term limit reform, which gives this class 12 years total in one house?
I think they finally got the message because, again, it's almost like in your workplace. You hire somebody in 6 years, once they really understand what they're doing, they're out. So people know if you want government to work, you're going to have some longevity.
Steve Bradford, we thank you for joining us. His name is Steve Bradford. He's a member of the California State Assembly. My name is Brad Pomerance. Thank you so much for watching California Edition.